What if someone sitting right next to you suddenly cannot speak properly, one side of their face starts drooping, or their arm becomes weak, and you only have a few minutes to save their life? Today, we are going to talk about stroke, one of the world's leading medical emergencies, where recognizing symptoms early can mean the difference between recovery and permanent damage. I am Dr. Sarah Mitchell, and today we are discussing a very serious and life-threatening condition, stroke. Many people think strokes only happen to older individuals, but strokes can affect adults of different ages, and in some cases, even younger people. The most important thing about stroke is this: fast action can save brain cells, prevent disability, and save lives. In this video, we will discuss what a stroke actually is, different types of stroke, early warning signs, the FAST rule, risk factors, emergency response, recovery and rehabilitation, prevention tips, and common myths people believe about strokes. So let's begin. What is a stroke? A stroke happens when blood flow to a part of the brain is interrupted. The brain needs a constant supply of oxygen and nutrients through blood. When blood flow stops, even for a short time, brain cells begin to die because the brain controls movement, speech, memory, breathing, coordination. A stroke can affect many important body functions. This is why stroke is considered a medical emergency. Saying why every minute matters. Doctors often say, time is brain. This means that every minute during a stroke, more brain cells may become damaged. Quick treatment can reduce brain injury, improve recovery, save a person's ability to speak, walk, or live independently. Delaying treatment can lead to permanent disability or death. Various types of stroke. 1. Ischemic stroke. This is the most common type. It happens when a blood clot blocks blood flow to the brain. The blockage may develop because of fat buildup in arteries, blood clots traveling from the heart, narrowed blood vessels. 2. Hemorrhagic stroke. This occurs when a blood vessel in the brain bursts and causes bleeding. Common causes include high blood pressure, weak blood vessels, brain aneurysms. This type can become very dangerous very quickly. 3. Transient ischemic attack, TIA, sometimes called a mini stroke. Symptoms may last only a few minutes or hours and then disappear. But this is a major warning sign that a serious stroke could happen later. Never ignore a mini stroke. The fast warning signs of stroke. One of the easiest ways to remember stroke symptoms is the word fast. Do you see F? Face drooping. Ask the person to smile. Does one side of the face droop or look uneven? Do you see A? Arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weak? Do you see S? Speech difficulty. Speech may become slurred, confused, difficult to understand. The person may suddenly struggle to speak simple words. Time to call emergency services. If you notice any of these signs, call emergency help immediately. Do not wait to see if symptoms improve. Other stroke symptoms. People ignore. Not every stroke looks the same. Other symptoms may include datu, sudden vision problems, blurred or lost vision in one or both eyes, difficulty walking, loss of balance, or sudden dizziness. Chakuspam, sudden severe headache, especially if it feels different from normal headaches. This may happen in hemorrhagic strokes. Confusion. The person may suddenly seem mentally confused or disoriented. Stroke symptoms in women. Women sometimes experience unusual symptoms such as extreme fatigue, nausea, fainting, sudden weakness, confusion. This can delay diagnosis because symptoms may not seem typical. What causes stroke? High blood pressure. This is one of the biggest risk factors. Over time, hypertension damages blood vessels. Smoking. Smoking narrows blood vessels and increases clot formation. Diabetes, high blood sugar damages arteries and circulation. Obesity, excess body weight increases strain on the heart and blood vessels. High cholesterol fat deposits can narrow arteries supplying the brain. Stress, chronic stress may contribute to high blood pressure and heart disease. Tuberous, heart disease. Certain heart conditions can increase clot risk. Can young people have strokes? Yes. Although strokes are more common in older adults, younger people can also be affected due to smoking, obesity, uncontrolled blood pressure, drug use, genetic conditions. This is why stroke awareness is important for everyone. Then what to do if someone is having a stroke? This part is extremely important. If you suspect stroke symptoms, call emergency services immediately, do not delay. Keep the person safe and calm. Help them sit or lie down safely. Do not give food or drink. Swallowing may become difficult during a stroke. Note the time symptoms. Doctors need to know when symptoms began because some treatments only work within a limited time window. Do not delay treatment. Never wait, hoping symptoms will disappear. Quick medical treatment can save brain function. How doctors diagnose stroke. Doctors may use brain CT scan, MRI, blood tests, heart monitoring. These tests help determine type of stroke, severity, best treatment option. Stroke treatment options. Clot-busting medicines. For ischemic strokes, doctors may use medicines to dissolve clots, but these medicines must often be given quickly after symptoms begin. Surgical procedures. Some patients may need procedures to remove clots, stop bleeding, reduce pressure in the brain. Rehabilitation therapy. Recovery may involve physical therapy, speech therapy, occupational therapy. Stroke recovery depends on how quickly treatment started, which part of the brain was affected, severity of damage. Some people recover well, while others may need long-term support. Emotional effects. After stroke. Stroke does not only affect the body. Some survivors experience depression, anxiety, memory problems, emotional frustration. Family support and rehabilitation are extremely important. How to reduce stroke risk. Control blood pressure. Regular monitoring is very important. Stop smoking. One of the best things you can do for your health. Eat healthy. Focus on fruits, vegetables, whole grains, low-salt foods. Stay active. Exercise improves circulation and heart health. Maintain healthy weight. Weight management reduces multiple stroke risk factors. Sleep well. Poor sleep affects blood pressure and overall health. Common stroke myths. Myth. Strokes only happen to elderly people. Reality. Younger adults can also have strokes. Myth. If symptoms disappear, it's nothing serious. Reality. Mini strokes can warn about future major strokes. Myth. Stroke recovery is impossible. Reality. Many patients improve significantly with rehabilitation and support. Why awareness saves lives. Many stroke deaths and disabilities happen because people ignore symptoms, delay treatment, do not recognize warning signs. Understanding stroke symptoms could help you save your own life, a parent's life, a friend's life, or someone sitting next to you one day. Final message. Stroke is a medical emergency, but quick action can save lives and protect the brain. Remember the word fast, face drooping, arm weakness, speech difficulty. Time to call emergency services. Never ignore sudden neurological symptoms. Your brain controls every part of your life. Protect it. Closing. If you found this video helpful, share this information with your family and loved ones because awareness can truly save lives. Thank you for watching and take care of you.